Is your chronic illness, chronic pain, or chronic injury due to your practitioner not looking deep enough at your case or thorough enough? Many chronic illnesses or chronic pains or chronic injuries could have simple solutions if you were just looked at on a holistic level instead of a myopic level. I'm Dr. John Bartemus, and I'm putting the pieces together to help you live a life at optimal. I've documented at length cases on my channel where I've talked about patients who have seen many, many doctors and haven't been looked at from a holistic perspective or looked at thoroughly or investigated deep enough. And when we do that, we find the root cause of their chronic illness or chronic pain or chronic injury, and we address it, and they get great results. Well, today I had a consultation with someone with chronic plantar fasciitis, so chronic foot pain, chronic foot injury of over a year. This person has seen occupational therapists, physical therapists, and chiropractors, and ebbed and flowed in terms of benefit, but has never got full resolution, has never been able to return to running like they would like to. Well, in questioning this person, they said that they've received adjustments from chiropractors, they've received dry needling and rehab work of their calf and foot from physical therapists, and received a little bit of care from occupational therapists. But what the person said was they've never been investigated thoroughly throughout their kinetic chain. So they've had their foot looked at and their calf looked at, but they've never had their knee or their hip or their low back looked at. Well, plantar fasciitis may be from something higher up the kinetic chain, say in the hip or in the low back or in the knee. And if you don't address that, all the arch stretches and calf dry needling in the world isn't going to cure their problem. So this was just another example of how, as practitioners, and we can get too myopic and too focused on the complaint and allow that to blind us from finding what really matters, which is the cause. And as a healthcare model as a whole, our healthcare model is guilty of this daily and minute by minute. So if you're suffering with a chronic illness and or chronic pain and or chronic injury, and you haven't been thoroughly investigated, meaning your entire person has been looked at, then it's possible that there could be a simple solution if the solution was just found. And finding the solution requires an in-depth look at you and your physiology and your biomechanics and neuromuscular system if we're talking about the injury. So if you've seen multiple practitioners and you're not getting that, you need to seek one out who will look at you not only for your pain site, but also at all other sites, and understand how all those integrate and find the cause that could possibly be far away from the pain site. The metaphor is that the painful site, say the plantar fascia in this person, is the victim in a crime scene. The painful site is the victim, so the victim's crying out. You're having the pain, saying, hey, help, hey, help. But what happens is by the time the police get there, the perpetrator or the villain is long gone or at another site, so to speak. So if we're not looking for the villain at the knee or at the hip or at the low back, all we're going to have is a screaming victim in the foot, and everyone's going to be frustrated. So we have to do our due diligence as detectives and honor the victim and what they're telling us, but then go find the villain and tackle him and arrest him and put him in jail so that the victim can stop screaming and you can get back to running.